Meet John. He's one of tens of thousands of healthcare professionals living in Canada who go to work every day. John loves his job, but every day is filled with highs and lows, from new births to emergencies and even end of life. Long hours and a hectic pace are John's reality, and that's on a good day. In times of crisis, when resources are strained, difficult decisions are made on the fly, and staff are forced to take on roles they've never done before. To put it bluntly, this line of work can be very stressful. Every worker deserves a workplace that supports and protects their psychological health and safety. And more organizations across Canada are taking action to put the right supports in place for their people. Not that long ago, John's workplace implemented the National Standard for Psychological Health and Safety in the Workplace. The standard is built around 13 key factors and designed to help employers of all types and sizes promote mental health and prevent psychological harm at work. But healthcare workers like John face two additional unique factors that do not happen in other types of workplaces. One is moral distress, and the other is psychological self-care. Moral distress happens when policies, procedures, or treatment orders prevent a healthcare professional from doing what they feel is right. Imagine that what John believes is the best way to treat a patient is different than what he's instructed to do. What if the situation is all new and there are no protocols to follow? Or in extreme situations where non-critical care has to be deferred. John knows his patient needs surgery, but now he's got to explain why they have to wait. What kind of weight does that put on John? Without supports in place, John feels conflicted and powerless, and that takes a toll. Add to that the second factor. John is used to putting his patients first. And when caring for others puts his own self-care in the back seat, things can fall even further out of balance. It's a spiral that can create all kinds of problems at work and at home. But John is a professional, right? He tells himself everyone has to deal with this here. I can't talk about it. I don't want to put more pressure on my coworkers. I'm on my own. The thing is, John isn't alone. Meet Mary. She's a healthcare administrator. She's also John's boss, but most of all, she's someone who understands that being a healthcare leader means caring for all people, including her own. Mary and her team have put in place wellness resources, including training and counseling that focus on psychological self-care and preventing moral distress. Some are structured like peer support programs, and others are less structured, but just as important, like making sure employees have some time to take a breather and recharge, no matter how busy things are. By taking action, Mary has created an environment that builds healthcare workers' mental resilience up instead of burning them out. And that's not only good for John, it's good for his patients, his coworkers like Sarah and Gabriel, and their families, and the hospital, and the community. Because making workplace mental health a priority helps employees be at their best. And that enables them to provide the best quality healthcare for all of us.